I've seen how you're doing it, but for people who might be interested, how are you guys able to kind of assess people's safety and assess, whether people are engaging in behaviors or not, like doing U-toxes and whatnot that we would normally do in the office when you're doing a lot of that virtually?
Well, there are still some patients. Certainly, we've always had patients who have a high level of acuity, and for some of our patients, we are still seeing face-to-face, and we practice the social distancing when they first come in. We're wearing a mask and gloves, and we take their temperature, and then we do our individual sessions in a group room where there's enough room, between us. And it's there's a much lower threshold for those of our patients who are at high risk. There's a much lower threshold in terms of measuring that risk for suicidality, for example, or injury behavior, self-harm, eating disorder behaviors. So as I said, the threshold is much lower because we're not seeing the patients every day. So we have to really, every day we check in with each and every one of the patients and ask them what their active symptoms are, and make sure that they're not at risk. And if they are at risk, that they get the help that they need.
And I think there's also like behaviorally in groups, the patients that are tending to try to blend into the wall or fade into the background, you can kind of draw them out in a little different way, and just noticing if their presentation in group is different than it used to be, or if they seem more isolated even when in a group, then that might raise some concerns for us that we can adjust accordingly.